Hello, my name is Dr. James Anthony. I'm a boarded veterinary dentist both in North America as well as Europe. And today what I'd like to do is introduce you to the GerMed instrument line for canine scaling. These instruments have been specially designed to meet the needs. It's unique for dog dentition, and as a result the width of the actual working end is actually much smaller and facilitates the ease of instrumentation beneath the gum line. The first instrument that I would like you to introduce you to is a dental mirror. This is to be used to visualize areas such as the palatal aspect of the dentition on the maxilla or the lingual aspect of the dentition on the mandible. This is also very nice to use as a retractor to pull the cheeks or the lips out of the way, so it facilitates your cleaning and instrumentation. The next instrument that I'd like to introduce you to is basically a Williams probe and explorer. The probe end is to be used beneath the gum line to measure gingival pocket depth. So the area between the tooth and the gums, that little groove there, is to measure the depth. We know the normal depth in a dog is 3 millimeters, so anything greater than that is considered abnormal. The Williams, or excuse me, the probe itself has little black markings here that are measured in 1 millimeter increments. The first one is 1, 2, and 3 millimeters. Then it goes to 5 millimeters, 7, 8, and 9 millimeters in depth. The opposite end here is called a shepherd's hook. This is used to explore, so that's why it's called an explorer. It's to explore for lesions. And these lesions are for above the gum line because it's very sharp and pointed, where if you use it beneath the gum line, you could result in some iatrogenic trauma. So these are to hit areas such as in the first molar, the groove here, to check for caries, if there was a fractured tooth to see if there's pulpal exposure, or any other lesion on the tooth surface itself. It's also used to make sure that the surfaces are smooth so that we don't have any calculus after the scaling. The next set of instruments that we're going to talk about are scalers. And the first scaler that I would like to talk about is the Morse Zero. The Morse Zero is used for scaling incisors, and also more importantly for the grooves and fissures on teeth, such as the fissure on the fourth premolar here. And this really facilitates the ease of that. The next instrument is called a Jacquet scaler. The scale, you gotta remember, scalers are just used for above the gum line, and this Jacquets are for large surfaces such as the canine tooth. It can be used for the gross removal of the debris on the premolars and first molar. However, for fine debris, we have another instrument that we'll talk about in a second. But this is good for removal of the debris on the canines and incisors, and there's a smaller end that's great for the incisors in between the incisors as well. The next instrument that I want to introduce you to, excuse me, is called the McCall's scaler, and this has a curve to it. You can see it has a curve, and this facilitates cleaning and scaling the back premolars and molars. It just, with that little curve, it facilitates the ease of cleaning those areas. After scaling above the gum line, we will try to scale beneath the gum line, which is referred to as root planing. And we have different instruments that facilitate that. The curette is basically an instrument that has a rounded tip that, when introduced into the gingival sulcus, is atraumatic and will not result in iatrogenic trauma if used properly. The first instrument of the curette I have here is a Gracie 3-4, and these are used for scaling beneath the gum line on the incisors and also the canine. So this is to go beneath the gum line, and basically you introduce it at a 90-degree angle, rotate it, and then pull out, and that's considered root planing. The next curette that we have is a Columbia 1314, which is very good for using for the premolars because it has a curved angle and it facilitates the manipulation of removing debris beneath the gum line on those teeth and the roots. And then finally, we have a Barnhart 5/6, which is good for removing the debris of the roots on the molars. It facilitates it due to the greater angle of the instrument, and as a result makes your life a lot easier and much better result at the far end than using, let's say, using the Gracie 3/4. As a result, the Gracie 3/4 in the back would cause a lot more difficulty for you to clean properly.